you Jacob?
Yep.
Hi Jacob, my name's Chelsea. I'm a nurse practitioner student with Clarion University. I'm going to be doing your exam today, is that okay?
Yes.
Can I call you Jacob?
Yep.
Great. Just going to wash my hands before we get started. All right. Upon first inspection, I see that he looks to be in good health. He appears his stated age. His skin is pink, warm, and dry. There's no real acute distress happening. I'm going to start with checking your vital signs. First with your blood pressure. We'll start with your left arm first. You could just slide your arm through here. Good. Good. And you just relax your arm for now. Gonna hold your arm right there. Great. (138/84). Excellent. We're gonna switch sides here. Great. That side's 142/94. A little higher on that side. Great. Upon first inspection, I'm going to look at his head. It is normocephalic. There's no trauma. It is symmetrical. I will begin the exam with his ears. I'm going to first start on the left side here. I note that the pinna is normal. There's no trauma, no redness, no swelling. And then I will look inside here. If I turn the light on first. Good. I'll hold the pinna up and back. Good. I see that the tympanic membrane is gray and pearly. The light reflex is present. There's no bulging or redness, no drainage, no signs of infection. The ear canal is patent with no redness or swelling. I'm going to move on to this side here. Same thing, the pinna is normal. There's no swelling or redness, no trauma. And I'm going to pull up and back. Sorry. Looking inside. I see the tympanic membrane is gray and pearly. The light reflex is present. There's no bulging or redness, no signs of infection. The ear canal is patent with no redness, swelling, or signs of infection. I'll change the tip of my scope here, and then we will examine your nose. I see that the nose is symmetrical with no trauma. I will look in the left nair. Is patent. The right nair is patent. The turbinates are present on both sides with no swelling or abnormalities noted. I will switch my tool here to my ophthalmoscope. We're going to assess his eyes now. They are equal bilaterally. The lids, there's no drooping or swelling, no redness. There's no tearing or drainage. The sclera are white. The conjunctiva are clear. The tear ducts are pink and moist. We will start with his pupils here. So I'm going to shine a light in your eye. If you could just look over my left shoulder here. I'm going to first do consensual reaction, shining the light in the left eye. The right pupil constricts. Shining my light in the right eye. The left pupil constricts. And then shining my light during the direct reflex. I'm going to shine my light in the left eye. The left pupil constricts. Shining my light in the right eye. The right pupil constricts. The direct response is good. I'm going to dim the lights here so I can see his eyes. Great. I'm going to first start with the red reflex. I'm going to stand about 3 feet away, looking in the left eye. I see the red reflex is present, and in the right eye, the red reflex is also present. I'm going to look closer. Here, sir, if you wouldn't mind just opening your eye for me. Good. The vessels converge medially with no patching. And in the right eye here. Good. There's no patching. The vessels converge medially. Moving on to his mouth. I will turn the lights back on. Moving on to his mouth here, I'll have him open up. Good. The mucous membranes are pink and moist. There are no ulcers or lesions. The tongue is midline. Go ahead and stick out your tongue for me, sir. Good. The tongue is midline with no deviations. The dentition is in good shape. Go ahead, you can stick your tongue back in. Go ahead and open your mouth for me and say ah. Good. The uvula is midline and rises with voice. I see that the neck is symmetrical. Can you turn your head to the left? Turn your head to the right. Good. Can you shrug your shoulders against my hands? Good. The neck is symmetrical with good range of motion. The strength is 5 out of 5. The trachea is midline. At this point, I would expose his chest and look to see for any scarring or barreling, any deviations. I'm also going to feel for his lymph nodes while I'm here. I'm going to start here with the pre-auricular, feeling with the pads of my fingers, the post-auricular, good, the tonsillar, the submandibular, the submental, difficult with a beard, the anterior cervical, the posterior cervical, the supraclavicular, I would do this without clothes on, the infraclavicular, and the occipital. Good. Next, his thyroid. I don't see any bulging from an inspection. I'm going to feel here. There's no enlargement, no nodules, no tenderness. I'm going to check. I would stand behind him at this point. Sir, can you swallow? Great. The thyroid moves up with swallowing, returns to position. Moving back to the chest, I will listen for lung sounds. At first inspection, I note that the chest rise and fall is equal and symmetrical without labor. He is breathing easy. Sir, if you could just take a deep breath and listen to the left upper lobe here. Left upper lobe. The left lower lobe. Good. Right upper lobe. Right middle lobe. And right lower lobe. Good. If you could sit forward for me, sir. Go ahead and take a deep breath. Left upper lobe. Left upper lobe. Left lower lobe. Good. Right upper lobe. Right middle lobe, or right upper lobe, and right lower lobe. Good. You can breathe normal. Go ahead and sit back for me. At this time, I'm going to listen to his heart. I'm going to start on the right sternal border here, the second intercostal space, and listen for the aortic valve. Moving to the left sternal border, the second intercostal space is the pulmonic valve. Moving down to the third intercostal space along the sternal border is Erb's point. Moving down to the fifth intercostal space at the sternal border is the tricuspid valve. And moving to the fifth intercostal space, hit the mid-clavicular line is the mitral valve. Great. I'm going to inspect your hands here, sir. If I can see. The skin is, turn over for me, please. The skin is pink and dry. There's no clubbing of his nails, no cyanosis. Cap refill is less than 3 seconds. Looking at his feet down here, I see that there's no pedal edema. The skin is pink and dry. There is no ulcerations or lesions. There's no discoloration to his legs. Feeling for pedal pulses here. Pedal pulses are 1+. The post-tibial pulses here are 2+. Without clothes on, we would feel for the popliteal pulses being 1+. We'd feel for the femoral pulses normally. We'll feel the radial pulses here, 2+ bilaterally, and then the brachial pulses here. Good, 2+ bilaterally. Then we will listen for the carotid bruits. I will feel for the pulse first. Great, the pulse is 2+ and bounding. No bruit noted. On the right side here, the carotid pulse is present, 2+, bounding. There is no bruit there as well. At this point, if he was a female, I would have him expose his chest so that we could do a breast exam. I would have him expose his breasts, look at them from a distance, looking for puckering, dimpling, any discoloration or rashes, any pulling at the skin, or nipple discharge. I would have her put her hands on her waist to assess for those symptoms, and then lean forward, again looking for specifically tugging of the skin, dimpling, puckering, that sort of thing. Then I would have them lay down. Sorry, could you lay down for me, please? And continue the breast exam. This time I would palpate each breast with the pads of my fingers in a circular fashion, feeling for any lumps, bumps, or palpable masses, including the axillary region, looking again for any inflammation or bumps, lumps, or masses. I would do that with the left side as well. We'll continue with the cardiac exam, listening to the heart sounds laying down. And back through. Good. Sir, if I could ask you to sit forward one more time. We will assess for the point of maximal impulse. If you could just lean forward for me. Great. Pulse of the point of maximal impulse is noted. The pulse is 2+ and bounding. The rate is within normal limits. The rhythm is regular. There is no thrill noted. Great. Now if you could just lay back for me, sir. We'll continue with the exam. Moving to his abdomen, I would expose the abdomen and just do a quick inspection, looking for any scars or striae, any obvious lumps or bumps, any asymmetry or distension. Then I would listen for bowel sounds next. Bowel sounds are present in all 4 quadrants. I'll listen for the aorta. There's no bruits noted. And then the renal arteries. Good. There's no bruit. And then I would also assess the femoral arteries for bruits as well. At this point, I will percuss the abdomen, listening for any dullness. And then I will do some light palpation first. Feeling for any lumps, bumps, palpable masses. Good. And then I'll deep palpation. Moving. If there was pain, I would do the area without pain first, moving toward the area with pain. Great. No lumps, bumps, or pulsable masses. At this point, I will have you go ahead and sit up for me, please. I'm going to test your muscles. You just tell me if anything hurts, okay? Any pain?
No.
Or tenderness?
No.
Good. Are you able to lift your arms out in front of you? Good. And bend them up. Arms to the side. Great. Can you lift your left leg up and out? Good. Can you bend the knee? Excellent. How about the right leg? Can you move it up and bend? Great. Excellent. Go ahead and push your hands against mine and push. Good. And then go ahead and pull back. Turn your hands this way. Go ahead, pull back. Good. Strength is 5 out of 5. Go ahead and push up. Good. And then go ahead and push down on my hands like you're pushing a gas pedal. Great. And then pull up. Great. Muscle strength is 5 out of 5 with no tenderness, no obvious deformities. Extremities are all equal and symmetrical. I'll move on to reflexes. Sir, you could just dangle your arm in this position here. Just let it be dead weight for me. Dead weight. Let it dangle. Great. Great. Go ahead and rest that arm down. The response is brisk. 1+ on that side. Go ahead and let your arm dangle. Good. Good. Response is 1+ and brisk. We'll check the brachial reflex here. Good. Reaction is brisk and 1+ on this side here. Good. The reaction is 1+ and brisk. We'll do the radial here. Turn your wrist out for me. Just relax your arm. Good. The reaction is 2+ and brisk. On this side here. Good. The reaction is 2+ and brisk. We'll do the patella here. Good. The reaction is 2+ and brisk. On this side here. Just relax your leg there. Good. Good. The reaction is 2+ and brisk. We'll do the Achilles here. Holding the tip of his foot here. The reaction is 1+ and brisk. And on this side here, I would hold his toes. I would say the reaction is 1+ and brisk. We'll do his neurofunction tests here. If you could just put your hands in your lap, alternate them. Perfect. Excellent. No cerebellar infarct. If you could take your finger and touch the tip of your nose, and touch my finger. Touch the tip of your nose, and then my finger. Good. Tip of your nose, and then my finger. Excellent. At this point, we would assess for his motor functions. If you could just stand up and take a couple of steps for me, sir. Excellent. His gait is steady. Excellent. If you could just bend over and touch your toes. Good. No spinal deformities. Go ahead. You can have a seat, sir. We would also assess his cranial nerves at this point. Number 1 is going to be the olfactory nerve. Do you have a change in your sense of smell?
No.
Number 2 is going to be the optic nerve. Number 3 is the ocular motor. Number 4 is the trochlear. Number 6 is abducens. Those are all tests that were done with the eye exam. We will briefly check the movement in his eyes now. Will you just follow my fingers? Good. The optic nerve was tested with the eye exam. The ocular motor test nerve is intact with the movement of his eyes. Number 4 is the trochlear nerve that was present with the downward inward movement of his eyes. And then number 6, that's the abducens nerve that was intact with the lateral deviation of his eye. Number 5 is going to be the trigeminal nerve. We'll test that with his jaw here. Just squeeze There you go. Clench your jaw. Excellent. Nerve is intact. Number 7 is the facial nerve. We will test that with the movement in his face. If you could just give me a nice big smile. Go ahead and close your eyes real tight. Good. Open them and go ahead and raise your eyebrows. Excellent. The movement is symmetrical bilaterally, meaning that the facial nerve is intact. Number 8 is the auditory nerve. We know that that's intact because he's having a conversation and able to hear. Number 9 and 10 were tested together. The glotopharyngeal and the vagal nerves. Those were tested when we looked inside his mouth, saw the uvula was midline, rises and falls with voice, and that his voice quality was intact. Those nerves are good. And then number 11, the spinal nerve. We know that that's intact with the strength in his neck when he did the shoulder shrug. And then number 12, the hypoglossal, that nerve was intact as well. Other than that, I have no other examinations to complete. Sir, do you have any questions for me?
No.
No? Okay, we're done here then.